The views and opinions expressed by the guest speaker on this episode are solely those of the guest. The content shared is intended for informational purposes only and should not be construed as professional advice or endorsement.
It's good to be here. This is Dr. Silvia Binder, CEO of the Ondamed companies in Germany, New York, and Nigeria, also the founder of the Binder Institute for Personalized Medicine. At the age of 15, I had quite a profound experience. After a motorcycle accident put me into a 3-week coma, I was clinically dead 5 times. It surely helped in gaining, I want to say, a heightened awareness. Going through these struggles certainly do some things to your psyche, to your mind. I became very aware of what I wanted to do and primarily what I did not want to do. So I ended up living in New York, and it wasn't until my first son, my second child, presented issues with a thrombus in his heart. He had congenital heart disease, received wonderful care at the age of 2. They operated on him at Children's Hospital in Boston. But when it came to a chronic issue that most likely was triggered by inflammation, that's when we have issues in mainstream medicine, because we try to fix it with pharmaceuticals, yet that often is a problem because metabolic functions are not working as well. Therefore, the medication is not best absorbed, or it may cause even more toxicity represented in the liver or in kidneys, in your metabolic functions. The case with my son was he was 5 years old and he had a 1 centimeter large thrombus sitting right on the valve in his heart. They gave him Coumadin, an anticoagulant and blood thinning medication, and it did not work. For 2.5 months he was on a medication and never in therapeutic ranges of where the blood should be. But I was either too thin, it was either too thick. And it was until that time that I was introduced to the technology Ondamed. It was that last week before his INR test would determine if he would go through open heart surgery again in removing this 1 centimeter large thrombus, this large clot from his heart. I used the machine 3 times, 15 minutes each, all personalized with the biofeedback loop. After 2.5 months of being non-therapeutic, it was the first time it was therapeutic to the blood thinning medication. It seemed that adding the physics to the chemistry made the miracle happen, that now he was in therapeutic ranges at 2.7 INR. So the physicians and surgeons suggested that I continue the treatments, and then we would monitor not only his blood coagulation levels, but also his clotting in the echocardiogram. 2.5 months later, using the blood thinning medication and the device on a regular basis, his clot had shrunk to 1/3 of the size that it originally was. So we knew we were onto something here. I decided, due to the negative side effects, in particular with small children, to remove the Coumadin administration. This propelled my interest in science and naturopathic medicine. I am a physician. I see patients. I write publications. I have a book on Amazon called Ondamed, A Story of Love, Healing, and Medical Revolution. And I sit on several boards, whether that is the Federal Ministry of Health in Nigeria or FAME here in the United States, which is the Foundation of Alternative and Integrative Medicine. I'm the Chief Medical Officer of Cymernetics in Canada. I spread the news of what works well in the most non-invasive way with the least amount of side effects. So I travel the world and I educate primarily physicians, also clinicians of all sorts, the use and the understanding and the science of energy medicine. And if you look at my story, it's just so amazing how life steered me into this direction, with my son being the perfect example of when you combine physics with the chemistry, of how the biology can react a whole lot better. And that leads me into the topic that I'd like to cover here, which is energy medicine. And energy medicine truly has been around throughout human history, dating back at least 15,000 years. And if you look at, let's say, I'm going to give you a few examples, the medicine man that uses his or her body in moving and dancing and using the voice and using natural aspects of maybe the rocks or feathers or blood or etc., etc. And that is to address the psyche, to address the soul that sits within the being and triggers a better mental being in the physical body. So today, medicine focuses primarily either on the physical body or on mental health, which it is all, of course, it's all one. So if we look back into the ancient times, even the Egyptians, of how they treated intuition, reaching into the sky, so to speak, on a medicine woman's head, it would symbolize downloading information, as I call it, from the knowing and helping people in using one's intuition. There is the father of modern medicine, Hippocrates, who talked about the energy flowing from the hands. There was Jesus, of course, who also laid down the hands, but he said, it is your belief that heals you, not my laying on the hands. So that leads me into the work of Bruce Lipton, epigenetics. Very important work, and he has been around for the past 20 years. And we've been lecturing on his work, that it is that which is above the genetics. Yes, genetics is important, absolutely. But will that genetic blueprint express itself or not? That is the science of epigenetics. And the environment has a lot to do with that. Your conditioning while you were growing up, the nutrition, supplementation, your perspective and your mindfulness has a lot to do with that. When I teach, I don't only teach on one aspect, but it is important to remember that we're multifaceted, meaning that so many different things play a role in becoming and staying well. My approach of integrative personalized medicine includes intuition, pulsed electromagnetic fields, combined with biofeedback to give the body electromagnetically of what it needs. It's like tapping into the communication pathways and helping to restore functions and to restore the repair and regeneration that the body's abilities of doing that itself, of course, and helping to balance, most importantly, to balance the sympathetic, parasympathetic nervous systems in order to create lasting effects. Because if you don't balance the nervous system, then everything else that we do within the body or mental health wise, it will not hold. So stability is extremely important. So to stabilize our patients, also to educate physicians and patients alike about proper nutritional intake. I also use a beautiful energy medicine technique, which is homeopathy, and a form that comes out of Africa and was reintroduced by Bert Hellinger, which is the emotional overload that carries through and can be dealt with in a therapeutic approach called family constellation. Also important, I love to incorporate Hamer's work, Gerd Hamer, the German medicine, which connects chronic disease to unresolved emotional shock and trauma still residing within the energetics of the biology. Then there's also the bioenergetic field, which is then outside of our body. That is Valerie Hunt's work. I did a lot of good work with her while she was still alive out in Malibu in California. It is the taking in and also the giving off of energy. It doesn't stop at the skin. Of course, the skin absorbs, and there is such a thing as the bioenergetic field, sometimes also called in Ayurvedic medicine the aura. Then, of course, I believe we help the body to regenerate inside, but also from the outside it's important to have massages and manual manipulation through osteopathic work or craniosacral work. Then I love Steiner's work, Rudolf Steiner, Anthroposophy. It's just amazing, just a take on how chronic disease unravels, how we can, with the help of Rudolf Steiner's work, the anthroposophical thinking, intuition, enhanced medicine, how we can unravel and unpeel the onions, the layers of the onions, in seeing what triggered, why are you having your, whether it is PTSD or whether it is cancer. There's another very important aspect to the work of energy medicine, getting to the root causes. And it's just not one cause, it's several causes. It's like a lifetime of health experiences. And the emotional state has a lot to do with that as well. So another one then in my planetary system, all the things that I use in my approach, Ayurveda and traditional Chinese medicine. So it was Nikola Tesla who in the beginning of the 20th century, he said, the day science begins to study non-physical phenomena, it will make more progress in 1 decade than in all the previous centuries of its existence. He had those huge Tesla coils, and look at back then, man didn't turn older than maybe in their 60s. And this man became mid-80s. That must have also something to do with the Tesla coils that he used on himself on an ongoing basis. Energy medicine, as I said, as old as human history, is being used every day around the globe. If you look at the diagnostics of, let's say, EKG, to measure the heart, EEG, to measure the brain, or MRI technology, CAT scan, ultrasound, you cannot imagine a hospital on a planet today without one of these or all of these technologies. And they're not measuring chemistry. They're all measuring the energetics of an organ. It's just in the therapeutics where it has been taken a much longer time due to needed clinical studies. And of course, when you personalize things, it is very difficult even to complete those studies on the therapeutic efficacy. So if you look at, again, laser surgery of the eyes, right? That is not chemical, that is a form of energy. And we have biofeedback, we have the TENS units, ultrasound used for stimulation of healing. And then we have, again, the combination of biofeedback and electromagnetic stimulation, the Ondamed, which is FDA regulated and even insurance pays on it. So that is a wonderful technology to never induce any harmful rays. If you look at, there's another one that's very similar based on the same mechanism of action. That is transcranial magnetic stimulation. However, TMS used primarily for migraine headaches and depression, if all other treatments fail, is a class 3 device because its intensity ranges between, I want to say 2 to 3 Tesla. When you look at the Ondamed, it ranges between 0.5 to 55 millitesla. So it's almost like a whisper to the cell. It never exceeds what a muscle would use in terms of electricity output when a muscle contracts. So it's a class 2, while a TMS is a class 3. They all have their purpose, of course, all of these technologies. But I want to tell you that there's a lot of science over the past 40 years, and it all started with the orthopedic surgeons at Columbia University in New York, where they found that even non-union fractures healed in the introduction of the coils of using pulse electromagnetic fields. And back from there, a lot of studies have been done that, for example, nerve repair can be done at 2 hertz, or you have the immune system stimulation at 835 hertz. So there's a lot of different numbers associated with an act of biological reaction to the introduction of pulse electromagnetic fields. But honestly, I tell you, that's not what I stand for. I believe that we need to ask, so to speak, through the biofeedback loop, what is needed and where is it needed on the body to help the body to repair and regenerate itself. So it's not about a particular frequency, it's doing particular things in the body, but asking the biology, what frequency do you need? And where do you need to apply the frequency stimulation? That is what the Ondamed so nicely offers for us. So it is important to know that there is a lot of science behind energy medicine. When I looked through the clinical studies on PubMed, I found more than 500,000 studies just entering different terminologies. There's no one term that describes energy medicine used clinically. And as a matter of fact, the US National Center for Complementary and Alternative Medicine actually had 2 groups. They split energy medicine into 2 categories. One was scientifically measurable, where electromagnetic therapy and sound waves would fall under. And then we had the energies that are not yet subject to measurement. You had, for example, acupuncture, qigong, ayurveda, homeopathy in that group. That's good to know that there's science backing up energy medicine, not only the use of energy medicine since humans crawled the earth, but ultimately when cells are more permeable to vitamins and minerals and oxygen, then of course the cell will function a whole lot better. And that energy medicine can be used in any type of chronic disorders, and also to help with well-being, to help in better aging, or to help in sports medicine, to help especially after COVID, and especially with, if you look at the soldiers coming back from terrible war situations, suffering from anxiety and PTSD and stress and depression. Energy medicine is an amazing tool to help these people in going beyond their levels of stress and anxiety and living a life that is haunted by memories that with of course, with a good therapist and talking about things is important to sort of detox those memories. And on the topic of detox, if you look at the connection between the health of the gut, your microbiome, and the health of your fluid in your brain, it's the same fluid. It is the interstitial fluid is everywhere, right? Not just the blood, not just saliva. So we need to make sure to be as clean as we can be on a level of fluid and energy. And I just want to give you some tips, such as exercise is important, and ideally exercise in nature. Take a walk in a park and bond with the beautiful trees and smell what's around you. Laugh and laugh is a wonderful one. Grounding is a good detox. Get yourself into a rhythm of wholesome sleep and sleep enough. As I said before, the manual manipulation so that fluids and energy can flow in a better and healthier way. Osteopathy. Of course, wholesome food is important. That includes good quality water, such as reverse osmosis. That's the best quality water that I have come to know. Very important is good breathing. when you breathe out, your body detoxifies. So exhalation, when you inhale the future, you hold deep within your lower belly, you hold the breath, and you breathe out, you exhale, and let the past go. Remind yourself at least 3 times a day to take a good, wholesome breath. It is important when we use energy medicine that we are able to use focused fields, tap into the communication pathways, just as your cell phone may be out of connection and within range of connection. It's the same within our cells. If you think about it, our cells communicate based on the electromagnetic signaling processes. So if there is a fluid buildup, then possibly the communication pathways are blocked, they are hindered. And whatever you do on the outside, if you don't use pulsed electromagnetic fields and give the body those fields that it needs to reestablish the communication pathways by reducing the buildup of fluid, then, or even to help to shake up a toxic area of maybe waste products, heavy metals, something that has been laying there and is just not able to move. And that includes also microbial issues such as fungal infestations or parasitic infestations. So we need to use, for example, the technology Ondamed to help bring our immune cells to the area of where we find through the pulse feedback and a buildup of an issue, an infection, an inflammation, so that the white blood cells or T cells, macrophages, that they would find those areas, don't swim around a family of let's say it's fungus and parasites, but that it would start attacking those areas. And so we're just guiding the immune cells to areas that they otherwise would not discover, because those microbes are brilliant. Look, they've been around much longer than the humans have been. And so they outsmart our biology. And of course, we need the symbiosis of living with the bacteria and the virus and the parasites and the fungus. The origin of disease, as I have mentioned before, can often not be found by those technologies we have. And even if we do a blood test, it may show, okay, everything looks good, our white blood cell count is okay. But if you look inside, there could be a connective tissue that can no longer let the cell communication and microcirculation flow through that buildup of waste and toxins, as I have mentioned before. But when you introduce energy medicine, you're able to get to that buildup and to help shake it up and help the local lymphatics, and then the systemic lymphatic to stimulate it and activate it. And that has huge impact on your mental state. As I said before, it is important to not only look at your brain when we are dealing with mental health disorders and mental health challenges, but it's important to look at the whole body. What if there is memories entrapped in scar tissues that they need to help break up? And I know this may sound maybe strange to you, but memory can reside anywhere. And it is important to deal with that, not only on a psychological issue, but also on a biological issue. It may be sitting somewhere on your body. It may be an old injury, it may be a surgery, or it may be a C-section that holds traumatic memory. So it is important to understand that we need to scan, and with the technology Ondamed, we can do that. And with the energy medicine approach, we can do that in scanning the body and giving the body what it needs and where it needs it, and finding those dysfunctional areas and honing in on layer by layer to see where are stressful areas in the body, and then focus the stimulation on those stressful areas. It needs to be understood that the mind, of course, can regulate our biology in ways that we probably don't even understand quite yet how powerful that is. And again, back to Bruce Lipton, he's done the work, and with his book, The Biology of Belief, and there's many others who have jumped on that wagon, the mind is able to control bodily functions. So if you look at the conscious part, if there was an ice block and you look at the conscious part, 5%, and probably not more, goes into the consciousness of being creative and thought and personal identity and awareness. But if you look at the remaining 95%, most of our subconscious, probably we want to call it, is undiscovered until we are becoming more mindful of that which is not so obvious. And mindfulness is an important word, and it is just so important that we may do, whether it's yoga or some sort of meditation, or I like to talk about living a meditative life, always trying to be in, as Sam Harris calls it, the void. I don't like the void, because the void is not a void as we would understand that word to be. I call it the knowing, because there's so much information in that void. If we can reside in that peaceful moment and let thoughts travel out like clouds, don't attach to the clouds coming into your brain, entering and wanting to distract you. Block those clouds out and become mindful and still, as Eckhart Tolle has this wonderful book, has written, The Stillness Speaks, and it's so true. I so agree. I'd like to say that humans are electromagnetic beings. I'd like to encourage all to bridge ancient wisdom with today's science. Using energy medicine can do that to stimulate the soul, which expresses itself mentally and emotionally, and manifests in and throughout the physical body. I want to encourage you to become that wonderful seed of being that is waiting to be discovered and nurtured in a loving and forgiving and benevolent way. Thank you for being here.